at City Hall today. So a reminder to everyone participating on Zoom, please keep your microphones on mute unless called upon to speak. Those participating by phone, please keep the phone on mute at all times unless called upon to speak, and do not put the phone on hold or use speakerphone. Thank you. Madam Board Secretary, can we have the roll call, please?
Certainly. Member Bannum, Member Carr, Vice Chair Di Giovanni. Member Dudas.
EC.
Member Gower.
Here.
Member Kavanaugh.
Here.
Member King.
Here.
Chair Kitts.
Here.
Member Lakin.
Here.
Membre Pinel.
Présent.
And Member Tilley.
Here.
You have quorum, Madam Chair.
Thank you. So we have regrets from Member Carr, who had a scheduling conflict, and just a couple of procedural notes for this virtual meeting. So we're changing the process for speaking from how we've done it in the past at this board. Now that we're getting more comfortable with virtual and hybrid meetings, I will be asking members to use the raise hand function on Zoom to signal that you have comments or wish to comment instead of going through the entire roll call. So is that everyone's cool with that? Okay, great. The usual 5-minute limit will apply, not counting the time for staff response. Remember that if a full recorded vote is not taken, I will ask if the item is carried and you can dissent on the item. And finally, if we have any technical difficulties and require a recess, members are requested to remain on the line unless the board secretary issues new instructions. Moving on, do we have any declarations of interest?
Yes.
Did you want to read it out, Member Lakin?
I, Member Lewis Lakin, declare a deemed pecuniary interest on Ottawa Board of Health Agenda 3, Item 3, 2023 Draft Operating Budget for the Ottawa Board of Health. Document 1, page 4. Ministry of Health Programs and Standards, Cost Shared Programs, and 100% city programs as a family member is an Ottawa Public Health employee working in these areas.
Thank you. Any other declarations of interest? Seeing none. Confirmation of minutes. Are the meeting minutes of January 30th, 2023 confirmed?
Confirmed.
Thank you. We have 2 communication items that are held on file with the Board of Health Secretary. Motion to introduce reports. Member King, please.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled 2023 Draft Operating Budget for the Ottawa Board of Health and 2021 Annual Report and Attestation to the Ministry of Health be received and considered.
Sorry about that. My screen got weird. Is that carried?
Carried.
Thank you. We will go to the consent agenda. So item 7.1, Chair of the Board of Health verbal report. I will be providing that. Item 7.2, Medical Officer of Health verbal report. We'll receive a report from Dr. Etches. 7.3, 2023 Draft Operating Budget. We will hold for a presentation. Item 7.4, 2021 Annual Report and Attestation to the Ministry of Health. Is this received?
Received.
Received.
Thank you. And then we have one item previously distributed. That's the update on audit of the governance of the city's pandemic response. Perfect. Okay, so we will go back to item 7.1, which is my verbal report. So to start, On February 3rd, as part of the Algonquin College Future of Health and Wellness Speaker Series, Dr. Etches, along with Dr. Lawrence Lowe, Executive Director and CEO of the College of Family Physicians of Canada, and Dr. Gaynor Watson-Creed, Associate Dean with Dalhousie University's Faculty of Medicine, participated in a panel discussion on the future of local public health units in Ontario, current and emerging issues in Ontario's public health sector, and the importance of the municipal government's role for public health units. The event was well attended, both in person and online via Zoom, and I was happy to see a number of council and board colleagues there, as well as local MPPs and representatives from partner organizations. It was an interesting and informative discussion, and I thought the panelists did a great job of explaining the unique role of local health units and how public health contributes to the broader healthcare system by working to assess population health, promote healthy public policy, and to keep people healthy and out of acute care. Les trois panélistes ont fait remarquer que la santé commence là où nous vivons, dans nos quartiers et nos communautés. Ils ont donc souligné l'importance de maintenir les liens entre les bureaux de santé publics locaux et les municipalités qu'ils desservent. For those who are not able to attend in person or join via Zoom, there is a video recording of the session on Algonquin College's YouTube channel. So I recommend you take a look. On Monday, February 6th, on behalf of Ottawa Public Health and the Ottawa Board of Health, I had the privilege of speaking in front of Ontario's Standing Committee on Finance and Economic Affairs as part of their pre-budget consultations. I took the opportunity to thank the Ontario government for its investments in local public health services, which have been essential in supporting the ongoing COVID-19 pandemic response. I talked about the disruption the pandemic response has had on our core programs and services, including those mandated by the Ontario Public Health Standards, programs and services that keep people healthy and contribute to a prosperous Ontario. I then drew committee members' attention to 4 shared priorities among Ontario's local public health units: immunizing children and youth against vaccine-preventable diseases, supporting parents, newborns, and children with essential needs to ensure they get a healthy start in life, supporting public health units to help prevent and limit the spread of communicable diseases, and improving mental health and addiction supports. En conclusion, j'ai demandé que le gouvernement revienne à la formule de financement de 75% de contributions provinciales et de 25% de contributions municipales au programme à coût partagé et que les liens existants entre les bureaux de santé publics locaux et leurs municipalités connexes soient maintenus afin que nos services atteignent les résidents près de chez eux. March is Nutrition Month, and this month is celebrated through Canada to draw attention to the importance of making informed food choices and developing healthy eating habits. It's also a time to recognize the work of dietitians. Registered dietitians are regulated health professionals who apply their expertise in food and nutrition to support individuals and communities to improve their health. Dietitians use the science of nutrition to help people and communities meet their healthy eating goals, and the work of dietitians in public health is to make the healthy choice the easier choice. Please join me in recognizing the work of OPH's dietitians and in thanking them for their role in improving the health of Ottawa's population. March is also Francophonie Month. Partout dans le monde, les francophones et les francophiles célèbrent la langue française et la francophonie pendant le mois de mars, dont le point culminant est la Journée internationale de la francophonie le 20 mars. À Ottawa, nous avons constaté un changement dans le portrait démographique des francophones. Ainsi, il est important de se rappeler que pour certains résidents francophones, le français n'est pas leur première langue, mais la langue avec laquelle ils sont le plus à l'aise au Canada. Nous reconnaissons que la francophonie n'est pas une communauté uniforme, mais plutôt un merveilleux kaléidoscope de cultures, de pratiques, de religions et de dialectes qui apportent une richesse à notre communauté, de nouvelles opportunités, visions et façons de faire. I encourage everyone to learn more about Francophonie Month by exploring some of our local resources, such as les rendez-vous de la francophonie, la Maison de la francophonie d'Ottawa, l'Association des communautés francophones d'Ottawa, and more. this concludes my verbal report, and I will be happy to take any questions. Seeing none, is this report received?
Received.
Received.
Thank you. We will pass to item 7.2, the medical officer of health's verbal report.
All right, well, good afternoon, Nakwe, Nasukut, Tanshe, Ani. I will provide updates on the recently released report on the Ontario Student Drug Use and Mental Health Survey, also our cold water response in collaboration with city partners, routine immunization, respiratory illnesses circulating in our community, and the ongoing plan to keep people informed. And finally, I will talk about Ottawa Public Health integrated planning process and how we're working to align our organization's efforts to reimagine the Ottawa Public Health work. That's all the feedback from employees and community partners, shaping those ideas to address our workload pressures, adapt our COVID-19 work, and then advance our emerging strategic priorities all within our budget envelope. So to begin with, last week, Ottawa Public Health released data on the mental health and substance use health of Ottawa students in the 2021 Ottawa Student Drug Use and Health Survey. We call it OSDUS for short. So OSDUS has been conducted every 2 years since 1997 by the Centre of Addiction and Mental Health. And that centre administered the survey to Ontario grades 7 to 12 in 2020 to 2021. So our epidemiology team analyzes the local data. Le rapport de 2021 met en évidence les défis auxquels de nombreux jeunes ont été confrontés pendant la pandémie de COVID-19, mais aussi la résilience et la capacité de nombreux jeunes de notre communauté à s'adapter à des défis sans précédent. So compared to pre-pandemic, several indicators of mental health and well-being worsened among Ottawa students in 2021. I'm sure that's not a surprise. But of particular concern, almost half of the students in grades 7 to 12 reported fair or poor mental health, and a similar proportion also reported wanting to talk to someone about their mental health in the past year, but not knowing where to turn. And we also noted that approximately 16% of students reported they had seriously considered suicide in the past year. So on all of this information, we're seeing that there are populations that have greater barriers to health, and those identifying as socioeconomically disadvantaged, older students, and 2S LGBTQIA+ people fare poorer in terms of their mental health and well-being compared to counterparts. In relation to substance use health, alcohol and cannabis continue to be the most frequently used substances. However, students in grades 7 and 8 in this last survey reported use of opioids at the same rate as their peers in grades 9 to 12. So that's a concern. Ottawa Public Health recognizes there have been improvements in our community since this survey was taken, and in particular, helping youth know where to turn for help has been improved with the introduction of One Call, One Click service that makes it one place to call or click to get access to mental health and substance use services. Though, of course, we know sometimes still when people get through that portal, there can be a wait for some support. So our role is to ensure that data like this in the OSDUS report is shared and informs policies and programs throughout the region. Our epidemiology team, in partnership with our mental health, addictions, and substance use health team, is working with community partners to share these results and help inform the development and adaptation of their programs, whether that's Ontario Health or school boards or others. Santé publique Ottawa continuera de collaborer avec ses partenaires locaux et régionaux, ainsi qu'avec Santé Ontario, pour veiller à ce que ces données soient utilisées dans la planification du système. So we'll continue to use this data as we develop and implement our regional mental health and substance use health dashboard, as we develop our wellness hubs in neighborhoods and our school outreach and community-based programming. On the cold weather response, just to highlight, there was a councillor inquiry seeking more information on how the cold weather response works. And so we issued a memo to council Friday to share further information. It was sent to the Board of Health and the Mayor and Council. Oh, sorry. It's further to information that was sent to the Mayor and Council and Board of Health in December, which was ahead of the cold season. Recognizing that cold weather events can result in adverse health impacts. In particular, we see that the homeless population can be at risk for frostbite and hypothermia. So to address these impacts, there's a City of Ottawa extreme heat, cold and smog plan, and that really does make sense because the heat and the air quality related issues with certain weather type events are all going to draw on some of the same partners to address support to populations. This plan outlines prevention, mitigation, and preparedness activities where the City of Ottawa and community partners work together to respond. Ottawa Public Health is responsible for communications to raise awareness of actions that prevent cold weather related illness, injuries, and death. Ces communications sont envoyées au public, au Conseil et aux fournisseurs de services qui soutiennent les populations prioritaires. So the service providers who assist people at risk during the cold, they receive pre-season information on what services and resources and prevention strategies can be put into play, and they're reminded of these resources as part of each frostbite advisory and frostbite warning messages are sent. This pre-season information we share broadly, and then the Ottawa Public Health Cold Weather web page includes information for everyone in Ottawa about preventing cold-related injuries. It includes links to resources in our community to help people access supports, including where to find winter clothing, hot meals and food, and community shelter, including transportation to shelter, and the locations where there's free public places to warm up. It's the city's Community and Social Services Department and community partners that ensure people experiencing homelessness have access to safe and warm emergency shelters during an extreme cold weather event. And within the emergency shelter system, there's always space available for those in need. Anyone who's unsheltered can access services by calling 24/7 to 311 or presenting themselves at a shelter. And outreach services and other partners that provide winter gear to those who are unsheltered do go around proactively at these times and ensure people have sleeping bags suitable for -30-degree weather, additional blankets, clothing, hand warmers, extra supplies to ensure that people who choose to remain outside during an extreme cold weather event can stay warm. So I will turn to the update on immunization and some of the measles related work that we're doing to be prepared. Ottawa Public Health is making continued efforts to increase uptake and coverage of routine childhood immunizations, including measles vaccination. Santé publique Ottawa déploie des efforts continus pour augmenter l'adoption et la couverture des vaccins infantile de routine. And in Ontario, measles vaccine is usually routinely administered at 1 year of age and with a second dose at 4 years of age, along with other routine childhood immunizations. So children and youth facing barriers accessing these routine childhood vaccines through their primary healthcare provider can now attend 8 Ottawa Public Health family and community vaccination clinics across Ottawa that are currently offering these childhood vaccines. Routine childhood vaccinations also been available at 6 Ottawa Public Health neighborhood health and wellness hubs in priority neighbors since this past fall. And we're going to offer this routine vaccination at an additional health and wellness hub starting this week. And we're aiming to expand to all of these neighborhood hubs this month. Within this next coming month, by mid-March, I would say. So Ottawa Public Health is just developing very specific targeted strategies to increase uptake of routine vaccinations in schools and neighborhoods with the traditionally lower vaccine coverage rates. And in addition to offering routine childhood vaccines through Ottawa Public Health clinics, we've been working to increase communications to raise awareness of and prevent promote the uptake of measles and other childhood vaccines. So at the beginning of January, Ottawa Public Health launched a campaign, Vaccinated and Up to Date. And we've been releasing promotional materials, including a new webpage. I think it's wonderful. Stop. Everything you need to know is there. We've got social media ads, content and videos, radio ads, and media interviews that have been supporting this effort. Communication products and handouts and multilingual web material are developed in Arabic, Somali, and Chinese. And we're also leveraging the partnership with Kids Come First to amplify routine vaccination services by sharing social media posts and information through the Kids Come First connections. And we're really thankful for CHIO and all the Kids Come First partners who are assisting with the promotion of immunization. The reemergence of certain vaccine preventable diseases is being seen across the world, and it is cause for concern. As I've said before, I think we are therefore within Ottawa Public Health organizing an incident management system structure that's bringing together various staff to monitor measles activity proactively and prepare for any community outbreaks of measles to be able to respond quickly with all of our tools. Our epidemiology team is looking at national and provincial incidences of measles and will certainly be instrumental in managing cases and contacts if local outbreaks arise. We're also raising awareness among healthcare providers locally about the heightened risk of measles, in particular with more travel during the March break season. And we're encouraging healthcare providers to encourage vaccination and have discussions with their patients. We do encourage all Ottawa parents and caregivers to ensure their children are vaccinated and up to date on their routine vaccinations. Cela permet de garder notre communauté en sécurité contre les infections graves comme la rougeole et la polio. So you can find out if your child or youth is eligible to attend one of our OPH vaccination clinics by visiting our website. It's www.parentinginottawa.ca. So here we are to the respiratory season update. And though the respiratory season continues and influenza, we're keeping an eye on, really the reported and confirmed cases and wastewater virus levels have decreased sharply for influenza compared to those seen in January. And the RSV also continues at low levels. So respiratory related emergency room visits also continue to decrease from peaks in November, and the pressure in the CHIO emergency rooms also is improved. COVID-19 is still here. It's not over. And although we have seen improvement from the levels of COVID in early January, we still see high levels in the number of COVID outbreaks that are occurring and in the wastewater indicators, and moderate COVID levels when we look at percent positivity. And although hospitalizations for COVID have decreased since early February over the last few weeks, they do continue to reflect serious illness in our community. So COVID-19 will continue to be an important contributor we can predict to illness and death in 2023. And so efforts to decrease the risk of infection are still advised, especially for people at risk of severe outcomes. Il est encore recommandé de prendre en compte les risques et ceux de nos proches et d'utiliser les mesures de protection que nous avons tous utilisées au cours de ces mois d'hiver et qui ont permis de réduire la propagation de ce virus. That's wearing high quality and well-fitted masks, staying home when sick, and getting your vaccines. Those are all important steps that help keep us and our community safe. Ontario expanded the eligibility for and access to Paxlovid and treatment for COVID to reduce the risk of severe COVID-19 among people at higher risk. And the Ministry of Health continues to adjust the eligibility for PCR testing. So now we know people who have symptoms, if they're 60 years of age or older, anyone 18 to 59 years of age, if they're immunocompromised or have one or more comorbidities that puts them at higher risk for severe illness, and pregnant people, among others, can all access PCR testing. And we have more information, of course, on our website. So these free PCR tests are offered at any provincial testing location, and rapid antigen tests continue to be available at no charge in a range of retail locations. The the province is maintaining a test locator tool on their website. So in terms of how we communicate this local information about respiratory illnesses, we recently shifted to a new dashboard that will give residents the information they need to continue to follow the levels of COVID, flu, and RSV in our community. That dashboard is updated weekly on Wednesday afternoon, and it can be found at ottawapublichealth.ca/virus report. So we're glad our media partners are continuing to use this information to highlight current community levels of risk for respiratory viruses. And our Ottawa Public Health website continues to maintain many tips to reduce your risk for COVID-19 and other viruses. And we're continuing, as you can tell, to promote people to use layers of protection as they go about their days. So lastly, looking ahead and some words on our integrated planning process. Ottawa Public Health Senior Leadership Team has been engaged in an integrated planning process that's brought together our short, our medium, and our long-term plans for the organization. So this has included our 2023 budget planning, which has brought you the recommendations today. Our next four-year strategy, which we'll be speaking about soon, we'll bring that to you in April. And the review and implementation of the reimagined proposals that were brought forward by Ottawa Public Health employees and community members. It's also been bringing together a review of our COVID-19 work, our efforts to address workload pressures, and our continued workforce planning and development, as well as we move into 2023 operational planning. So our goal is to ensure that the work we do and why we do it is all in alignment. It includes looking at our priorities and implementing our learnings from the pandemic, especially continuing the work to prioritize the needs of Ottawa's diverse populations. La nécessité d'intégrer l'équité en matière de santé et les déterminants sociaux de la santé dans tout ce que nous faisons est la leçon que nous prenons à cœur alors que nous réimaginons notre travail. Nous mettons également l'accent sur la prévention dans toutes nos activités, qu'il s'agisse d'initiatives de promotion ou de protection de la santé. So I've shared with the Ottawa Public Health team internally the key words that really can help us condense what we're focused on into three phrases. That is that Ottawa Public Health is equity-driven, prevention-focused, and impact maximizing. And so to that end, we see common goals with others across the Ontario public health system. We are drawing attention of the provincial government to our shared priorities across the public health system that require stable, predictable, and sustainable funding in the coming years. The first shared priority being immunizing children and youth against vaccine-preventable diseases. It's one of the most cost-effective interventions available to ensure that Ontario's children have a healthy start in life. And the second priority being supporting parents, newborns, and children with the essential needs to ensure they also develop to their full potential. And through the Healthy Babies, Healthy Children program, which is funded by Ontario's Ministry of Children, Community and Social Services, public health units are providing home visits, drop-in clinics, online support, and referral services for children. This program plays a key role in reducing long-term provincial costs to social and health systems. One aspect of this program in Ottawa is that we currently offer 6 drop-in clinics for parents across the city. Most are in neighborhoods with low-income families, equity-seeking groups, and parents that face barriers to access health services for their children. But there is demand for additional clinics to be established, especially in rural Ottawa. Unfortunately, with our current funding allocation, we are not able to meet that demand. And we see this as the budget hasn't grown and our population is growing. The third shared priority is supporting public health units to help prevent and limit the spread of communicable diseases. So you can see that the burden from communicable diseases is not going away, and increased investments are needed to modernize our health information systems, such as the provincial case and contact management system, and accelerate the outbreak management tools, development that we need. And the fourth shared priority is to improve mental health and addiction support. So the Ontario government's aware of these priorities and the situation, and I really want to thank the provincial government for its investments in local public health services over these last years. We have really relied on the provincial support. It's been essential to keep our work going, not only the pandemic response, but also in addressing these 4 areas. So my job is to ensure that the province understands the local impacts of these 4 priorities, as well as looking at what's needed to adequately support this work and keep people healthy in Ottawa and contributing to a prosperous Ontario. So this concludes my verbal report, and I'd be happy to take any questions. Merci pour votre intérêt.
Thank you, Dr. Etches. Did you have a question? Just a reminder, we're using the raise hand function. Councillor Gower, please, or Member Gower.
Thanks, Chair. Just wondering, with the recent federal provincial health announcements around funding, is there any indication that any of that will flow through directly to public health initiatives, or do you see any of the announcements beneficial to the priorities that you've identified for Ottawa Public Health?
We haven't had any word of any direct flow through to the public health system at this point. We are pleased that the federal government is recognizing the need to assist with funding the pressures that the local, provincial health systems are facing, and also appreciate the interest in being able to use metrics to take a look at outcomes and key areas are of importance that have been named, but we don't have anything specific to public health at this time.
Okay, thank you, Chair.
Thank you. Member Kavanagh, please.
Thank you. I just appreciate your message, Dr. Etches. And I was wondering about moving forward in terms of the record keeping for vaccinations and how that's going, because I understand that's a big breakthrough, that one of the positive side effects of the pandemic, and how that will help with children and vaccinations.
So you're right, Member Kavanagh. We have a COVAX database that enables us to understand who's received the COVID vaccine across the province, whatever their provider, pharmacy, public health, primary care. And this is a model I know the province is interested in building on. We don't have any details yet in terms of how quickly that can happen or what form or shape this would take, but I would say it's a common interest we share, and we're encouraged that there may be some possibilities into the future.
Thank you. I appreciate that we're talking about these topics now, that they're going back to the regular vaccinations. I know Member Diaz-Giovanni would be very interested in that subject as well. Thank you so much.
Thank you, Member Kavanagh. Member King, please.
And I could add, like, in the interim, since we don't have an easy system right now, we are finding ways to make it easier for parents to report. And this is, again, work with Kids Come First to promote the Can Immunize app. And there is more information, again, on our website about how to make sure your record is with public health, because your doctors don't always just pass that on. It's not usually part of the process. And to make it easier, the Can Immunize app helps parents have the record themselves, get reminders. So there are some tools that can make it easier at this point. Yeah.
Thank you for that additional information, Dr. Etches. Member King, please.
Thank you, Chair. And I just wanted to thank OPH for responding really quickly to the inquiry around cold weather response. Obviously very timely. We have challenges in the city with our unsheltered residents, and I know that Dr. Etches pointed that out. And obviously, our offices, member of council offices, get inquiries concerning this. So it was really excellent to have an update that would provide, especially newer members of council, the information required to respond to incoming inquiries. So just wanted to say thank you for that rapid and good work.
Thank you for that, Member King. Okay, I'm not seeing any other hands. So is this received? Lots of shaking heads. Received. Great. Thank you. So we'll move on to item 7.3, the 2023 draft operating budget. And so we will have a presentation from Joanne Henderson-White. And then we have no delegations, but we do have a motion. So we'll get Joanne here, and I think there's a presentation to go up on the screen. Hi, Joanne.
Hello. Good evening.
Over to you.
Thank you. Unakut, good evening, Chair, Board, and to other members present, including members of the OPH team and leadership. Ce soir, nous présentons une mise à jour du budget fonctionnement provisoire de Santé publique Ottawa qui a été déposé le 30 janvier 2023. As you consider the 2023 draft operating budget tonight, we will provide a high-level recap of the details of the budget since our January 30th. Slide 2, please. To recap, the 2023 operational budget formally presented and tabled is balanced and aligned with city budget directions for 2023. It incorporates municipal tax support increase of 2.5% and growth to increase base funding from the city in the amount of $1.24 million. The funding formula for cost-shared programs are covered at a ratio of up to 70% provincial and about 30% municipal, and remains unchanged from 2022. There are no changes in assumptions, and as previously stated, the budget assumes a 0% provincial-based increase and assumes all one-time COVID-19 requirements will be provincially funded at 100%. We are grateful to the province for continuing to fund COVID-related costs. A summary of the previously tabled figures is provided on the next slide for your reference. You will recall these details from the tabling of the draft budget on January 30th, 2023. We presented a budget of $128 million, which is broken down between $77 million of base funding and $51 million of one-time COVID funding. It included revenue from the province anticipated at a total of $99 million. Revenue from the city was anticipated at $27 million and from other sources at $1.4 million. Next slide, please. Le 30 janvier 2023, l'occasion a été présentée aux commentaires du public tout au long du mois février. The report was tabled or posted online as of January 30th. As well, a dedicated email address and telephone number were made available, and invitations were extended for written submissions or the option to register to speak at tonight's meeting. There were no communications received as of today's board meeting through any of these avenues. Through other avenues, however, we have heard interest in our work with older adults and our work through health and wellness hubs. Next slide, please. So the expectations for this evening's meeting. Once the board approves the operational budget tonight, it will raise to Council on March 1st for final approval, and then will be submitted to the Ministry of Health for consideration. We are therefore recommending approval of the 2023 draft operating budget, approval of the operating resource requirements, user fees, and revenues as presented in the draft operating budget for 2023. We are also recommending that the Board of Health direct staff to forward the budget report and amendments to Ottawa City Council for consideration on March 1st. And finally, that the Board of Health direct the Medical Officer of Health to forward the 2023 Annual Service Plan and budget submission to the Ontario Ministry of Health for consideration based on the approved 2023 operating budget. Ceci conclut ma présentation. Napromek Miigwech, merci. Your questions are welcome.
Thank you very much, Joanne. So we do have a motion regarding the sustainable funding for public health. So I'll ask Member King if you'll read it into the record, and then we will go to questions about the budget from members.
Absolutely. Whereas Ottawa's public health 2023 draft operating budget reflects a tax base and growth increase from the city that is aligned with City Council's budget direction for 2023, and it assumes a 0% provincial base increase from the province. And whereas year over year, the City of Ottawa has consistently provided for annual inflationary growth increases of 2.5 to 3% to OPH's operating budget, while base budget increases from the provincial government have not been as consistent or reliable, leading to the budget being developed based on assumptions, which creates uncertainty. And whereas in 2019, the province announced a change in the provincial municipal funding model for local public health units from up to 75% provincial and 25% municipal to up to 70% provincial and 30% municipal, with temporary mitigation funding to offset this increased pressure on municipalities through the last few years. And whereas to date, neither OPH nor the City of Ottawa has received assurances from the province that the mitigation funding will be increased from the 2018 level or continue beyond 2023, which represents a $3 million pressure to the municipality if the province ceases to provide the mitigation funding and does not revert to the previous 75-25 funding formula. And whereas in addition to providing for annual inflationary increases, the City of Ottawa provides in-kind support to OPH for a wide range of administrative functions such as facility management, human resources and labor relations management, information technology, legal services, financial services, and more, with an estimated value of $9.9 million annually. And whereas just as hospitals have backlogs for surgical and other procedures, local public health units have catch-up work to do in areas such as dental screening and treatment, immunization, TB control, chronic disease, and injury prevention initiatives, and more. And whereas the burden of infectious diseases continue at high levels with COVID-19 and other infections, and base funding needs in this area are likely higher than they were pre-pandemic. And whereas OPH also needs to account for population growth, inflation, and increased demand for digital solutions. And whereas up to and including 2022, the Ministry of Children, Community and Social Services budget allocation for OPH's Healthy Babies, Healthy Children program was $4.5 million, representing a 0% increase since 2008, resulting in offering services to families based on their levels of risk. And whereas further requirements associated with HC screening and liaisons were added in 2013, and liaison work continued with 4 Ottawa hospital birth units. And whereas due to a lack of primary care providers who are able to accept newborns in Ottawa, OPH has seen an increased demand for home visits and drop-in clinics, from parents and their young children, resulting in OPH being unable to meet the demand within its existing funding allocation, even for families at the highest levels of risk. And whereas local public health units provide programs and services that promote well-being, prevent disease and injury, and protect population health, resulting in a healthier population, which conserves costly and increasingly scarce healthcare resources. And whereas to continue to plan for and provide the programs, services, and supports residents need the most where they most need them, local public health units need sustainability and certainty from their funding partners. And whereas investments in public health generate significant returns, including better health, lower healthcare costs, lower social services costs, and a stronger economy, therefore be it resolved that the Board of Health for the City of Ottawa Health Unit direct Councillor Catherine Kitts, Chair of the Board of Health, to write to the Premier of Ontario, the Ontario Minister of Health, and the Ontario Minister of Finance to request that the province revert to the 75-25 funding formula for local public health units, commit to maintaining the current relationship between Ottawa Public Health and the City of Ottawa, recognizing the significant in-kind contribution the city makes to OPH, and building this into the cost-shared budget to ensure that working together, OPH and the City of Ottawa can continue to meet residents' needs when and where they are most needed, and commit to providing some defined level of inflationary increase to local public health units' annual base funding allocation going forward to ensure ongoing sustainability and reliable services to a growing population, as requested in the Association of Local Public Health Agencies 2023 public pre-budget submission dated February 14th, 2023. And be it further resolved that the Board of Health for the City of Ottawa Health Unit direct Councillor Catherine Kitts, Chair of the Board of Health, to write to the Premier of Ontario, the Ontario Minister of Children, Community and Social Services, and the Ontario Minister of Finance to request that the province provide a one-time increase in the funding allocation for OPH's Healthy Babies, Healthy Children program to reflect the growing needs for these services and the fact that this funding has not increased since 2008, and commit to providing some defined level of inflationary increase for this program's annual funding allocation going forward to ensure ongoing sustainability and reliability. And be it further resolved that the Board of Health for the City of Ottawa Healthcare Unit forward this motion to City Council in conjunction with Council's consideration of the 2023 draft operating budget for the Ottawa Board of Health, and request that Council endorse the recommendations contained herein, and further request that Mayor Mark Sutcliffe co-sign the above referenced letters to the province demonstrating the City of Ottawa's support for these requests.
Wonderful. Thank you very much, Member King. So we will deal with that in a moment, but we will go to questions for staff on the budget. So if you do have questions, please raise your hand. I will go in the order that I see them appear. Member Gower, click on the draw. Over to you.
I was ready for this one. So I want to ask, we have a responsibility under the Health Prevention Act to meet certain provincially required standards. Is Ottawa Public Health able to do that with the budget that's in front of us today?
Thank you. We are able to carry out our work under the Ontario Public Health Standards with this budget. I will reference the other report that was on the agenda that you carried related to an attestation that we can do this, and you would have noticed that we had some challenge carrying out all of our chronic disease and injury prevention work last year. That was report, actually, this 2021 report, and this is work we expect to return to. Some of the Ontario Public Health Standards are less prescriptive in how we do the work. And so I would say that we have to adjust the intensity or the reach or the methods that we use. We have to be more innovative. If the resourcing is not keeping up with population growth, and we need to reach people through partners, perhaps more often. These are all ways we're considering growing our chronic disease and injury prevention work. And also referenced in that report was that we had to do some of our other work related to control of infectious diseases and inspections, taking a risk-based approach. And that will continue under this budget. We will still have to do some risk assessment and prioritization of inspections in order to be able to carry out the work within the budget we have.
Okay, thank you. Yeah, I think when you take the budget and the report you've referenced, and also the letter we received from the Association of Local Public Health Agencies, I think it's really key to what our board needs to be focused on over the next 4 years, is understanding what the provincial standards are and what we're mandated to do, whether or not our board and our city council is providing you with the resources, and understanding how OPH may be adapting and taking a risk-based approach or prioritizing where the resources are focused. I think these are all things that we need to have a really clear understanding of as a board. And I thank you for the presentation and for the information in front of us tonight. Thanks, Chair.
Thank you, Member Gower. I will say too, if you have questions on the motion, we can take both questions at the same time. It was developed in collaboration with staff. So we will go to Member Bannum.
Wonderful. Thank you, Chair. And thank you, Joanne, for your presentation this evening. And thank you to Member King for the motion. A lot of my questions were actually answered in the whereas section of the motion, so that was helpful. But I guess for clarity's sake, I'm hoping Dr. Etches, I've been bringing up the Healthy Growth and Development program for pretty much my entire first term on the board. And this is just indicative of one of the 100% funded provincial programs that OPH oversees and implements. But I guess I'm wondering if you could speak to, if there hasn't been an increase since 2008, how has OPH been responding to a massive increase in population, but also increases in what I presume would be, COLA, salary increases, et cetera? Has this meant that fewer visits are able to be done? Has this meant that fewer programs have been able to be run through the community? And so if you could speak to maybe the impact of not receiving increases, that would, I think, be helpful for us to really hear and understand. And of course, if there are other 100% programs that you can speak to as well, or that have been similarly impacted, I'd be happy to hear those examples as well.
Sure. On the healthy growth and development work, you can imagine with a fixed budget that hasn't changed really from 2008, as the obligations we have to pay the cost of living increases under collective agreements continue to grow, we've been able to fund fewer people to carry out the work. And so I will pass it over to Esther Mogadam, who is our Chief Nursing Officer and also oversees the work of the Healthy Growth and Development team, to describe a little bit more what that's meant in terms of ways we've changed services.
Thank you, Dr. Etches. Good evening, Chair and board members. As Dr. Etches mentioned, we really have had to shift the program fairly significantly over the last few years. More recently, we've had to discontinue our prenatal classes, and as well as stopping our pregnancy circles, which was a great way to reach people earlier than in their postpartum period. The other shift that we have had to make is really changing the way that we're reaching clients. We've created actually a somewhat more efficient system, and I think probably better at what we do now, rather than relying on the initial liaison initiative that you saw referenced in the motion, which was a whole process of setting up fax systems coming into OPH. We now have nurses working at point of care directly in the hospital, so they're reaching parents. And they're reaching parents sooner, and really, I think we're reaching people in a better way, especially those that are facing challenges. We would often lose them to follow up and have a lot of trouble reaching them by phone. So that's been good, but unfortunately, we've been reaching the people who really need our help. And what started out, the Healthy Babies, Healthy Children, started out as a universal program. We're now at the stage where we really can only see families that have more than 4 risks. So typically a risk would be someone who's experiencing some mental health challenges, substance youth health challenges. They may be attached to children's aid. They also have complex situations such as unstable housing or financial hardships, and as well are experiencing family violence. So that would be the typical family that we would see. So we're not able to really meet the universal obligation that the program was originally intended to do. As such, we can't reach the same number of families. So we're working, we're working with families for a shorter period of time. They tend to be with us for about 5 or 6 months, and then we move to discharge. Whereas previously, we would often be able to work with them at least for the first 12 months. So that's very unfortunate. But that is another shift that we've made. What is really difficult for us and the team is that it's now about a 4-week wait period before we can come into the home and do the home visit. So those are really some of the challenging parts of how we've had to adapt and really shift towards a more risk-based approach. Having said that, there are some new initiatives that have been very helpful. Dr. Etches mentioned earlier the neighborhood hubs. So we're in 6 or 7 neighborhood hubs across the community, and there we can provide breastfeeding support. We can assist with the assessment of growth and development milestones, and also for those families that are unattached, provide immunization. And many of our Healthy Babies, Healthy Children clients are unattached and really do benefit from the hubs where we have our PIO or Parenting in Ottawa service in place. The other shift that we've made that's really positive is that the work with our partners like CSSD have really helped us to identify people who are pregnant and homeless earlier on, and assist us to working together, finding shelter for those clients. And then I think the last thing that I just like to add, because it is positive, we need to do more of it, but we are working right now with the Montfort, who is allowing nurses to be able to provide a direct referral for those moms who are really struggling with postpartum depression. So I think that's a summary of some of the changes that we've made. I also have Manar Molly with me, the program manager for the program. I don't know, Manar, if you have anything to add. Otherwise, back to you, Dr. Etches. Thank you.
I guess just to quickly follow up, it sounds like vulnerable populations really are impacted when you think about, the canceling of prenatal class teaching, the peer support that was gained through the pregnancy circles. Those are things where when you need to seek them privately, have a high cost and are a large barrier for many people who might otherwise not get that same support. So it sounds like you've been doing your best to accommodate these individuals, but it does sound like more funding is needed. Thank you.
And Chair, just to answer the other question about 100% provincially funded programs and how those are being invested in over time. In the funding formula change of 2019, which was based on 2018 figures, actually most of the other 100% provincially funded programs became cost shared. So that's a shift. So now they're cost shared with the municipalities, and the only one that remains 100% provincially funded at this time is the Ontario Seniors Dental Program, and that one's actually been very strongly funded by the province. It's a new program. There is capacity there to continue to grow service to seniors for dental care needs in our community, and that's work underway. We're also thankful that the province has provided capital funding to grow the number of clinics that can serve seniors' dental needs in Ottawa. So we appreciate that.
Thank you. Is that, did you have any other questions, Member Vanna? You're good? Okay, thank you very much. Member Kavanagh, please.
Thank you. Thank you, Chair. I always love listening to Member Bannum's questions since she has so much expertise. I love the motion. I don't know who to give credit to. Is that yours, Member King? Or okay, it's excellent, and I hope the message gets sent very strongly that we're saving them money, that public health saves the province money, that all these things are helping with downstream costs that they are trying to privatize, and that is just speaks volumes about how important it is, particularly the primary care. I really appreciated that mention about especially for infant care. That was excellent. My question is about inflation and costs of inflation and how that was worked around, because that is a huge issue everywhere, and how we're dealing with that. Does it mean cutting and staff reductions or anything like that?
So OPH is seeing increased cost in all non-compensation contracts, including supplies and other operating expenses that are up for renewal. Our budget, our 2023 budget, does not cover these increased costs. So the additional costs need to be absorbed within the current operating budget. This means that we need to be more innovative in the way that we deliver services, such as holding virtual meetings as we're doing tonight. And also this reduces travel costs. So these are some of the areas that we are being innovative and trying to make reductions as much as we can and being efficient in the way that we deliver services. I don't know if there's any Dr. Etches wants to add to that. Innovation, being streamlining and being creative in our response, given the current climate in which we're operating, is our approach. Thank you.
I don't think Dr. Etches has anything to add to your good words, Ms. Henderson-White. Thank you. I saw that we had a collective agreement, and so that puts us in some shape. I believe I saw that. I just wanted to know if that, I didn't, I just saw something about that on the sheet that, but I wanted to know if that, how long that's for, and I was a little concerned about down the road in terms of inflation. So
as is the city's practice, An anticipated increase of 2% has been built into the 2023 budget. If negotiated increases are in excess of 2%, its existing operation funding from the city. However, we do not expect any new collective agreement terms in this calendar year. So we've got a bit of a buffer and some time to make any preparations that may arise when we get to the point where we're doing where collective agreements are being negotiated. Thank you.
Thank you. Okay, thank you again.
Thank you, Member Kavanaugh. Member King, please.
Thank you, Chair. And I can't take credit for authoring the motion. I'm moving a lot of procedural motions this evening, but I must admit that I, like you, Member Kavanaugh, completely agree with the sentiment, and am very honored and proud to actually move this motion. I think Member Kavanaugh also beat me to the punch in terms of questions around inflation, which I was going to ask. So the only outstanding question I kind of have is around, I suppose, criteria for the budgeting around the public health standards, to go back to Member Gower's initial question. So I'm just wondering how we calculate that, whether that is an exercise that we do internally or that the OPH does internally to ensure that the allocations are right, notwithstanding the fact, as Dr. Etches said, there are elements of this budgeting that is not prescriptive. But I'm just wondering, what are the mechanisms internally to do that, to determine that we are spending the right amounts of dollars, and whether obviously there's a mechanism to ask if we're not, in the event that we're not, that we access more funds either from the province or through a request to the city.
Yeah, I think, we've had 3 years of transition, of change in what we've been delivering. And over the last year, it's really given us a chance to do that reflection about how do we need to carry on from here? What do we need to resource? What can we leave behind? What do we need to grow into the future? And so it really was a process. This budget was informed by ideas from employees that we asked for. We called them reimagine ideas. Over 3,000 ideas came in. We had about 18 bigger ideas that we needed to work up and really think about what would it take to do more and go in this direction. Many of the ideas were quality improvement, things we could just implement. But I would say, about 18 or so required greater thought in terms of allocation of resources. We also looked at the compliance, the attestation report, and what are we doing? What are we struggling to get done? So this has been a very thorough assessment this past fall and into this time, where the roles we need, everyone on every team, we've thought about the roles that we need going forward. And so, I think this is what we're looking for as we look to, we recommend you pass this budget, is then to take this and align the resources to the mandates we have, and the pressures that we see. A big feedback from the team has been that their workloads have been unsustainable. And of course, we know that was bad in pandemic peaks, but we don't want this to be ongoing. We need sustainable ways of working so that staff can stay well and keep the population well. And so some of the thoughts are about addressing areas with greater workload pressures. And this is part of what we'll be doing, to reflect our strategy as well. Talking to you about the priorities to continue neighborhood work, to address health equity. All of these things are being built in this integrated planning process I described.
I appreciate that. And I guess the last question is just around and I know that this was raised as we entered a new council term I believe by Councillor Gower, just around the needs in terms of FTEs and qualified employees, new employees that we might seek. I think I had mentioned to you, Dr. Etches, that having been invited to speak to a nursing class, I had proposed that those nursing students really take a look seriously at public health and Ottawa Public Health as an employer. So I was just wondering if you could briefly speak to maybe the employment needs and if there are challenges, and if this budget helps address those types of challenges in terms of hiring.
So this budget maintains our base number of full-time equivalents of 511.1, and so we aren't able to grow the overall number of people that work with us. We are seeing that it would be helpful to grow the workforce. We have lots of immunizing to do, and that's good work that nurses are uniquely positioned to be able to assist with in many ways. We also have the inspections that we need to continue. So I think it was in the attestation report, we don't have enough public health inspectors to actually carry out the work that we're mandated to do. So this is something we've been again discussing with the province, and they're very much aware. They have a human resource strategy in development for the province, and they're thinking about public health human resource needs. So I'm very encouraged by that. They've heard from the inspectors as well. They know nursing is a core public health function. I would say there's some other roles that we don't always hear about where we are interested in continuing to make it attractive to work for Ottawa Public Health, whether that's dentists, dental hygienists. We have needs for environmental health specialists, for epidemiologists, for communication specialists. There are so many different public health professionals that work for us, physicians. There aren't a lot of people that are specialized in public health. And so when we need to recruit to some of these roles, sometimes some of the training is on the job as well. And this is one of our priorities for 2023, is to really build back our training and development program. So I see it that we need to recruit from the community with a focus on equity deserving groups. We've heard this from our employees, from external audits. And I'm thinking of how we use our volunteer programs, our student placement programs, and to really focus on engaging with people who are from equity deserving groups, and then offer that career pathway within Ottawa Public Health. We need to make this very, very much stronger. And that's one of our goals for 2023 and beyond.
Well, I appreciate those answers. Thank you, Chair, for the opportunity to ask the questions.
Wonderful. Thank you, Member King, and thank you everybody for your questions. I don't see any more hands. So just before we vote on the motion, I do want to thank Member King for moving it. It was a team effort with much credit belonging to OPH staff, but you read it beautifully, so thank you. And we know that this incredible team is committed to finding innovative ways to deliver programs and services. We saw that throughout the pandemic, and we want that good work to continue. And OPH in Ottawa is really joining other public health units across Ontario in drawing attention to this issue and to the 4 shared priorities. And it's important that we establish the stable, predictable, sustainable funding in the coming years. And putting my counselor hat back on, we know how many other pressures municipalities are facing. So it's really important that we get the province to step up in this regard and revert back to that 75-25 funding formula before we feel the full effect of these pressures. And as Member Kavanaugh said, it's in the best interest of the province. We are saving them money, lower healthcare costs, lower social services costs, strong economy, and of course, better health. So hopefully province will be listening. I would be more than happy to author this letter, and I think it is important that we are also forwarding it to council to get its full endorsement as well. So with that, is the motion carried?
Carried.
Wonderful.
Carried.
Thank you, everyone. Member King, we are keeping you busy tonight. We have the roadmap motion that I'll ask you to introduce on the budget, please.
That the Board of Health for the City of Ottawa Health Unit, number 1, approve the Page 4, Ministry of Health Programs and Standards, Cost Shared Core Programs, Ontario Seniors Dental Care Program, Healthy Babies, Healthy Children, 100% City Programs, Miscellaneous Programs, COVID-19 one-time, and page 10, user fees. Number 2, upon the Board of Health's approval of the 2023 draft operating budget for the Ottawa Board of Health, direct staff to forward the report to Ottawa City Council for consideration on March 1st, 2023, as part of the City Council's approval of the City of Ottawa 2023 draft operating and capital budget. And 3, upon approval of the 2023 draft operating budget for the Ottawa Board of Health by the Board of Health and Ottawa City Council, direct the medical officer of health or delegate on behalf of the Board of Health to forward the 2023 annual service plan and budget submission to the Ontario Ministry of Health for consideration based on the approved 2023 operating budget for the Ottawa Board of Health.
Thank you, Member King. Is that carried as amended?
Sorry, Chair. We're going to have to ask that the board vote on each line item.
Okay.
So that Member Lakin can abstain from voting on the 2 lines where he has declared a conflict of interest.
Okay, so we've got,
So if we can go through the motion again, stopping for a vote on each line item, please.
can I just say 1A, 1AI, does that work? Or do you want us to read it?
Yes, no, that's fine.
Okay, so on item 1AI,
Carried.
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 and there's a conflict of interest on that one.
Yes, that's correct.
Wonderful. 1A2,
Carried.
Carried.
1A3,
Carried.
Carried.
1A4,
The balance in bulk.
okay,
Now that we've gotten through those line items. Thank you.
okay, wonderful. Carried as amended. Thanks. Ellen.
Carried.
Carried.
Great. Thank you.
Madam
Okay.
Secretary.
So, yes, thank you, Deanne, for keeping us organized. Okay, we will go now to we don't have any motions requiring suspension of the rules. I don't see any notices of motion. So confirmation bylaw, Member King, please.
Here we need the motion to adopt reports, please.
Oh, apologies. Motion to adopt reports. Member King.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled 2023 Draft Operating Budget for the Ottawa Board of Health and 2021 Annual Report and Attestation to the Ministry of Health be received and adopted.
Is that carried?
Carried.
Wonderful. Now confirmation bylaw, please.
Be it resolved that confirmation bylaw number 2023-2, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of February 27th, 2023, be read and passed.
Carried.
Carried.
Thank you. We have no inquiries, so we will adjourn. Next meeting is Monday, April 17th, 2023. So got a little break, but thank you, everyone. And have a great rest of your evening.
Thanks all. Good night.
Thank you.
Thank you.
Take care.
Thank you. Bye-bye.
Thanks all.
Recording stop.